Hi, everyone, and welcome back to another session with Fresh Dental Shadowing. Today we have Dr. Sweeney, and we are super excited to have her. So, whenever you are ready, Dr. Sweeney, you can take it away.
Yeah, thanks everyone so much for having me. I'm really excited to be here. So, just to give you a little glimpse about myself, so I am a general dentist and I currently practice in Miami, Florida, but I am originally from Buffalo, New York, and I'll get into it in my schooling, but I was living in Pittsburgh for about the past 8 years prior to living here. So, that's just a little bit about myself. So we're basically going to go over, what it looks like to be a general dentist, what that entailed in terms of my education, what my journey to dentistry looked like, what my day to day looks like, and some things that have kept me interested in dentistry, such as the mouth body connection, and a few fun cases just to show you guys a little glimpse into what I get to do. So, as a general dentist, I'm sure you guys have heard this before. But as a general dentist, we are the quarterback for the team. So we are the one who sees the patient typically first and creates a treatment plan for that patient, or basically a roadmap of where the patient is, where they want to go, where we decide to go, and how we're going to get there. So our specialists rely on us for that. We basically make referrals out to our specialists, whether it's in our office or to an external office, and we are doing a good portion of the treatment, but we are really the one who is deciding where the patient is going and kind of making calls from there. So different things that it can look like depending on what you decide to do as a general dentist. That is one of, I think, the beauties of dentistry, is that you can really tailor your practice to whatever you want it to be. And that can be anything from emergency treatment to oral surgery and extractions, including wisdom teeth or third molars, if that's something you're comfortable with, endodontics or root canals, restorative fillings, which is your typical, what people call their bread and butter dentistry, what you see every day, prosthodontics from crowns, bridges, dentures, to implants, to cosmetic dentistry, veneers, anything considered cosmetic, to orthodontics, including Invisalign, and actually braces if you do have training in that, all the way to facial aesthetics, Botox, and dermal fillers. So your day can really look so different. My day as a general dentist may look completely different from someone else's, just based off of how I choose to practice, the procedures I choose to do, and how I structure my practice. So again, that's one of the amazing things, is you can really make it unique to you, what you enjoy, how you want to practice, what you want to do for your patients, and what you want to offer. So for me, like I said, I went to school at the University of Pittsburgh in Pennsylvania, originally from the north. So the move to Florida was definitely different for me. So I went there not only for college, but also for dental school as well. So I received my DMD, which, as you guys probably know, a DMD and a DDS are the same. They're synonymous. Why we still have both degrees is unknown, but we do. So I received my DMD from University of Pittsburgh School of Dental Medicine. I also decided to get a certificate in public health while I was there. I really enjoyed public health, that kind of dove into that a little bit further. Often schools can offer a dual MBA, so business degree, public health. I know some actually even do law degrees as well. So if you are interested in that, definitely keep that on your radar for schools if you think that those could be routes that you are also interested in. Like I said, I have my degree also from the University of Pittsburgh, my bachelor's degree in nutrition and dietetics, which for me, the reason I chose nutrition is I liked science. I knew I loved nutrition and really enjoyed studying that. And for me, it allowed me to do much better in my undergrad career compared to studying something like biology or chemistry, which was required. But for me personally, I just didn't enjoy it as much. So keep that in mind. I'm not sure what age range everyone is in college, but if you're someone who hasn't picked a major yet, don't feel like you are cornered into having to do a typical science class. You can do anything from English to business to a foreign language to really anything that you desire, as long as you have the required classes to apply to dental school. So just keep that in mind. Always choose something that you are going to enjoy, because you're going to excel in an area that you enjoy versus just trying to force yourself into something that you think might look good on a resume or on an application. So deciding factors for me for dental school really were across the board. When it came down to it, for me, a lot relied on location and my comfort in that city and kind of what the program had to offer. I wanted to feel like I was at home. So I didn't have specific requirements at the time when I was applying to dental school in terms of exact specifications from the program, just because I truly didn't know that much when I was applying. I don't have any family in dentistry or anything, so I wasn't exactly sure what I was looking for, but I knew location really mattered to me. So for you, when you're deciding on a dental school, just think to yourself, what really matters most to you? Is it the location? Is it the class size? Is it the cost of your school? There's so much that goes into it. And just determine for you some of those few non-negotiables, what's really important to you. It'll help make your application process and deciding process as you start getting into dental school is that much easier when you know exactly what you're looking for. But of course, I understand we all have to keep options open. So just to keep that in mind. Scholarships, I did have what was considered an athletic scholarship from the University of Pittsburgh to the dental school when I was in school, but that was really the only scholarship I think I was on. I know for Pittsburgh, at least, they didn't have tons of scholarships aside from the, I'm drawing a blank on the name, but they offered 2 scholarships to their kind of highest ranking students per year, and then a few research scholarships because Pittsburgh is a very big research school. But I chose not to participate in the research once I was in dental school. But again, there's a lot of scholarships through dental schools, through outside organizations that can help with that. And if you're someone that's really concerned about cost, because I know for everyone, even if you do have assistance elsewhere, it's expensive. We know that. So having the Navy scholarship programs, the Army, Navy, military, any of those, as well as the nonprofit, I'm again drawing a blank on the name of what it's called, but there are those scholarship programs that provide year-to-year service for scholarships. So definitely look into those programs and see what's available for you and what fits you. I personally did not do a residency. I did look into them and was debating if I wanted to specialize, if I wanted to do a 1-year residency, and ultimately decided not to, just because, again, it came down to location for me when I was coming to the end of dental school. I knew where I wanted to be, and I applied to a few programs, really did not think they were a good fit for me and what I was personally looking for. So just to give you insight into that, I was looking for a program that was going to give me a lot of implant experience, because that was something I felt was lacking at my dental school at the time. And I just really didn't find a program that I thought was going to give me that in the location that I wanted to be. And for me personally, it came down to what it was going to cost me to do a residency and what the benefits that I was going to get out of it. So ultimately, I decided that private practice or going right into practice was the right option for me versus doing a residency. That's not for everyone. And there are a lot of great residencies out there. So again, it's just kind of like dental school. It's a personal decision, really researching into those residencies that are available when that time comes for you guys, and just seeing what fits for you, what makes sense, anything like that. But feel free to ask me questions further about that if you guys want to know. So my college tips. So GPA, I know GPA and DAT are really pushed into everyone's mind when applying to dental school. And again, they do matter a lot, but it is not everything at the end of the day. I know very strong applicants who actually had better GPAs and DAT scores than I did, but didn't get into dental school. So again, keep in mind, it does matter. You need to hit a certain threshold. So what I really recommend every student does if you are applying to dental school is get that ADEA booklet that has every single dental school in it. It has all of their averages of what they look for, DAT, GAP, or wow, I cannot speak right now, GPA, DAT, and a few other things that just kind of give you a breakdown of what their previous entering class had. That gives you a good idea of what schools are in your reach, what might be reach schools for you, what might be a safety school, and just kind of gives you a good idea what to look for. Because again, GPA matters. You have to be within their certain threshold. Again, if they say that their average is a 3.9 and you have a 3.5, that might be a reach school for you. It doesn't mean that you won't get in, but just to be realistic with yourself on some of those things. So as you can see, my GPA was not bad, but I was not a 4.0 student at all. I will be the first one to admit that. But yeah, so again, I got into dental school. My GPA, my DAT were very average. It was nothing phenomenal, but it was also not super low. So yeah, again, just keep that in mind that if you might be on the lower end when it comes to your DAT or GPA, you can strengthen that with extracurriculars, volunteering, research. There's a lot of things that you can do to be a stronger applicant on paper. And then once it comes to your interview, it's really just letting your personality shine on that. So for me, as you can see, I had some different extracurriculars. I was involved in some other things. It's been a while. So I'm trying to think back to what I was involved in at that time. But I was on the dance team, was on an executive position for nutrition club, as well as another club. But I wasn't involved in a million and one things. I chose a few things to be heavily involved in that I could really talk about. Same thing with volunteering and with research. I was not someone, the thought of doing research honestly terrified me in college. I was like, oh no, I really don't want to be in a lab doing this all day long. But the good news is you don't have to be doing a research that you don't enjoy. There's a lot of options out there. You can reach out to any professors, any organizations that do research at all, and find something that might be more in your niche or more in your interest. So for me, I did saliva genetics, which actually allowed me to go around the dental school, speak to some patients, collect samples to enter in their DNA database that dealt with different dental diseases, how it related to genetics, and was a much more personable way to do research for me, as well as working with a weight loss management center and nutrition program that, again, aligned with my interests. So keep that in mind, that don't just do something because it will look good on a resume. Make sure you enjoy it, because it'll make your time doing it that much easier. And when you are in an interview or in your application, you're actually able to speak about that and truly talk about why you enjoyed it, why you did it, versus just having to say, okay, I checked that box. So kind of already mentioned on this, but when you're applying to dental school, really figure out what matters most to you with that school. Whatever that is to you, if it's that you know in your heart of hearts that you want to specialize in a certain area and you want to make sure that school has that specialty program because you've heard great things, that's fine. Tailor whatever it is in your search process for that. Doesn't mean you have to only apply to schools that check those boxes, but make sure that you have, your few favorites in there based off of what you're looking for. Because 4 years is a long time to spend somewhere that you hate. So, and a lot of money to spend on it as well. So make sure that it's something that you think you will enjoy, whether it be the city, stuff to do there, the cost of it to save money, or whatever that might be for you. Again, research the schools. Like I said, that ADA booklet is great, has a lot of information about a lot of different dental schools. If you know people, or the beauty of social media is that you have access to, I would say probably at this point, every dental school, or students at every dental school at this point. So make sure that you reach out to other students who are at that dental school specifically to get their input as to what their program entails, why they chose it, different things like that. Most people are pretty open to answering those type of questions. So I know also, I think it's Future DDS, they did a whole video series, I believe, about every dental school at this point. So check them out as well, to see their thoughts from students who were at those dental schools at the time when they gave the interview. It gives you just more insight into the day-to-day pros and cons of every single school, because every school does have pros and cons. and you'll really only hear the true versions of those from the students who are there. Costs and loans that are available. Again, don't let the cost of a school completely wipe you out from applying there and be hanging over your head if you're so concerned about the cost. Again, dental school is expensive. There's no way around that. But if that's truly your passion, there are ways to help yourself in that, whether it's finding a program that fits your need, that has in-state tuition for you. Just research into it. Don't let that be the sole reason why you don't apply to a school or apply to dental school altogether. Like I said, pros and cons of that program, talking to dental students for sure. So one thing that I did in dental school and was to date probably one of the best experiences I had in dental school was mission trips. I don't know if every school offers them, but we definitely had different ones at our dental school. So I actually got to attend and lead 2 different mission trips in Jamaica internationally. And then we also went on a few local mission trips in Pittsburgh, as well as to like Virginia and a few other places through Mission of Mercy, through Special Olympics, getting to work with the Special Olympics athletes. So tons of routes available for that. And truly, I think that is what makes dental school experiences like that worth it, because you get the hands-on experience. You really get to interact with patients. It's the first time you really get to do a lot of procedures in an environment that feels like you're more on your own. And oftentimes you're allowed to do these programs at the beginning of clinic or when you're kind of just getting started. So it really helps you get your feet wet and understand what to do and get those fun experiences. So I had the ability to go with about a team of 14 people. We led everything from doing our own donations to fundraising to having to deal with customs, the entire organization of getting all the donations for equipment, tools, medications, all of that. Really fun experience. I would definitely recommend doing that if you guys have the ability to. I know COVID has made everything a little bit different now, but it looks like we're getting back to that point. So hopefully by the time that you guys are in dental school and at that age, you will have the opportunity to do trips like this. So practice for me, I have been practicing about 2 years now, and I have been in private practice, a corporate or what they call a dental service organization, as well as a nonprofit organization. So I have kind of seen almost every aspect of what a practice can look like at this point, having been in all 3 realms. Deciding factors for me, a huge portion has been office culture. So how the owner doctor runs the practice, how does the staff and doctors interact with each other, interact with patients, just what is that like in the office? Is it a happy and positive environment? Are they joking around all the time? Is it very serious? Like, what does that look like? And it's going to look different for every office, and each person is going to want something different. So thinking about what fits you, what type of environment you're comfortable in, what do you like your work environment to look like? That was huge for me. Mentorship, where I am now. So I work with a company called Pacific Dental. They are an overarching company that deals with the business side of things, but each individual office is run more similarly to a private practice. So I have an amazing office that I work with, a great owner doctor, and an awesome staff, and awesome hygienists that we work alongside. And I've had the ability to really be mentored by my owner doctor, by some of our specialists. And to me, that was huge because that offers you what a residency does, but in the environment where you're doing the work, you're getting paid for it. So it's just something that is priceless in my mind, because you won't always get that. And that's not something that is just unique to private practice or unique to a corporate office. It's really unique office to office. It's finding someone who's willing to be that mentor for you. How someone practices. So your practice philosophy and the work that you do, the quality of work, just the type of procedures, different things like that is going to impact your time in an office. So maybe what that owner doctor does might be different than what you do, but are they willing to allow you to pick and choose the procedures that you want to do? Or are they going to force you into doing different things. Just keeping those type of things in mind. And like I said, the practice philosophy, how they practice, what they choose to do, what standards they hold themselves to, their ethics and morals around that are very critical. If you don't align on that, just like any work environment, it can be really tough. So finding someone that you align with will really make your life much, much easier and much more enjoyable at work. And again, same thing that goes for applying, accepting jobs. That's what I have found. Took a little while to get there, but have truly found that at the nonprofit that I'm at, as well as the current office that I'm at. So my day-to-day, like I said, I have been in all three realms. So currently I work at an office called Dentist at Midtown. It's under the Pacific Dental Organization. I want to say they have around 300 plus offices now. Don't quote me on that. I might be totally wrong, but I believe they have around that amount. We have a region in South Florida that there's a handful of offices, and I know California, Northern Florida, some of the Midwest states, they have different offices across the country. So we see around 8 to 14 patients a day. It really varies, but I would say at minimum, I'm seeing probably 8 patients a day. We see a lot of new patients every single day, so it gives you a lot of opportunity to meet new people, do a lot of different procedures. We're relatively high volume office just because the nature, the type of patients we take a lot of insurances, but we do have some cash patients or what they call fee for service. So at my office, there's 2 general dentists, myself, as well as the owner doctor. We have 3 specialists currently, our oral surgeon, our endodontist who does root canals, and our periodontist who, if you don't know what that is, it's totally okay. Going to dental school, I don't think I knew majority of terms. So don't be afraid if you feel like you don't know what a lot of terms mean. But a periodontist is someone who deals with the gum and bone health. So we refer any of our patients who have severe gum disease, who may need implants, gum surgeries, different things like that, to our periodontist. And then I also work for a nonprofit organization called Caring for Miami. So I used to be there about once a week, but as my office has gotten very busy, I have limited myself. I'm now there about once to twice a month. I love that. That is what I consider kind of my passion project. I've been with them almost 2 years now as well. So we offer free dental care to uninsured low-income communities. And I just really love being in that environment with those patients, being able to offer a service with our mobile dental unit all across the South Florida region to those areas that really can't have access to dental care, or just don't have the funds to do so. So really unique environment to be able to do that. But so my week can look different depending on that week, if I'm there, if I'm at my office. And then, like I said previously, I was in private practice. Just a little bit different environment. It's every office is going to differ. For me, it was definitely a little bit slower office. We had more what we call fee for service or cash patients, more cosmetic dentistry in that office. But for different reasons, I ultimately changed practices and found an office and a mentor who really has fit me very, very well. So this is one thing, I don't know if you guys have heard about what they consider the mouth-body connection, but that is one thing that on day-to-day keeps me very passionate about dentistry. Having had a degree in nutrition, I love to be able to talk to my patients about diet, nutrition, and how everything that we put into our body not only affects, our heart health, our weight gain, but also affects our teeth and all of our conditions, and everything that's going on in our mouth affects the rest of our body. For example, if you have a patient who has uncontrolled diabetes and has uncontrolled gum disease in their mouth, those 2 things are playing off each other. So those same bacteria that can affect your heart health, your diabetes, or other chronic diseases also affect your mouth. So those things really play off each other, and being able to stabilize one thing can help stabilize another. So that's something that's really neat, and being able to educate my patients on that, being able to talk to them about how they might be doing a great job brushing and flossing at home, but why do they keep getting cavities? Well, what are you eating and drinking all day long? Those have a huge effect on your body as well as your teeth. So a lot of cool things around that, and being able to look at patients as a whole person. We don't just deal with single teeth. there is a person attached to that, there's a story attached to that. So really bringing it back to that whole patient perspective and that, you know, medical standpoint of looking at the health overall of that entire patient is something that I really enjoy and keeps me really passionate about what I do. Another thing that's very cool, and technology is really allowing us to understand more about patients' risk for diseases, is oral DNA and saliva testing. So that's been neat for me to think back to in college, actually, when I was doing research with kind of just the same stuff, that I've now seen some of the technology that has come out that is along that same route that we can use on a day-to-day in private practice. So that allows us to test patients' saliva for risk factors for different types of bacteria, to see what risk they're at for gum disease, for cavities, different things like that, to really personalize someone's care according to those high risk factors, those low risk factors, seeing where they're at there. So there's a lot of neat technology that is out there. There is also something I forgot to include on here, which allows us to use a light scope in video to determine if someone has areas of high risk for cancer. So that is something that when we do what's called our head and neck exam, we're checking someone's mouth, teeth, tongues, cheek, everything, checking around their head and neck to see if there's any abnormalities, any pathology, anything out of the normal, or anything that looks suspicious. This camera can also help detect things that the naked eye cannot. So being able to see that, and actually having some patients where it has actually come back that they did have an area that was high risk, it ultimately was cancer, and we were able to catch that for them, or being able to find pathologies and detect them. It's just amazing being able to do that for a patient, because they see the dentist typically about twice a year. So we're seeing areas and we're seeing a patient more often than even their primary care doctor. So being able to be that intervention for a patient really can be life altering. And I just included a few terms down here for anyone who doesn't know what periodontal disease is. It's just the form of advanced gum disease, which includes bone loss, and then caries, decay, all mean cavities. Again, if there's terms that you guys don't understand when I or any of the other dentists are presenting, don't get fearful of that. Don't get discouraged. Again, when I applied to dental school, I don't know that I could name more than one or two instruments, including a high-speed handpiece. So don't worry, it does not affect your ability to get into dental school. If you know the terms of something or not, it does not, that does not indicate how successful you can be in that field by any means. So don't let that scare you. And if you do have experience in it, that's great. So just some fun cases for you guys to look at. So just to go across, these are just a few of the ones very different from each other. So this first case on the left, you'll see the before and after. So my patient came in, and you'll notice that you see those top teeth hanging down a little bit more. They look like they're spacing. So just to give you an idea of what is happening. So this patient had very severe periodontal disease. Her teeth were very loose on the top. The spacing and the reason those teeth are dropped down is what was happening over time is that bacteria got under the gums, created a lot of bone loss to the point that those teeth became very, very loose. So over time, when someone has severe gum disease or periodontal disease that is untreated, what will continue to happen is that you will lose more and more and more bone over time until ultimately those teeth start moving, they become loose and have to be taken out. So that was creating spacing for her, because again, as the bone went down, teeth like to space out. In the same way that if you've ever seen a fence, you want it rooted deep into the ground, right? If it doesn't, you see those fences you can probably think of on some of those farms where they're really splayed out, right? Because they're barely in the ground. Same thing with your teeth, just to give you kind of that visual. So that was going on with her. Those gray portions in her gums on the bottom were actually 2 implants she had previously placed, but had never had anything put there. So on the bottom, what we ultimately did is what's called an all-on-5 surgery or an all-on-4 surgery. Basically, that means that all of the teeth were taken out on the top. It was planned via a 3D x-ray, so an entire x-ray of her skull. It was planned with 3D software by our specialist. So I worked hand in hand with my periodontist or my gum and bone specialist to plan out this patient's treatment. So my periodontist decided to plan everything. Him and I worked hand in hand with this to plan out where the implants would be placed. The same day that all of those teeth were taken out, the implants were placed in there. A bone grafting material was also placed to help surround that bone and make sure that that bone was stable. And then we placed what was originally a denture or something removable, was modified to fit those implants. And she wore that temporary prosthesis for about 6 months. 6 months later, we fabricated her final prosthesis, so it doesn't have anything on the roof of the mouth like a typical denture would. So it doesn't come in and out. It stays in place. The patient only comes to us about once a year to have it removed and cleaned. We give her instruction on how to clean it at home, but it stays in place. So it is screwed into those implants. It does not come in and out. And then on the bottom, we put what's called a implant retained bridge. So it used those 2 implants as anchor pieces. As you can see on the bottom, it covered that area completely. And then the patient is still in treatment because we are going to be doing kind of the same process of those implant bridges on those lower teeth, just because they aren't as stable as we would like them to be long-term. So we kind of staged out the process, but the patient is almost through the treatment. So just to give you guys an idea that that is what we went through with that case on the left. So again, that involved referrals to my periodontist, implant placements, bridge fabrication by me, different work, referrals to our hygienist, who she is coming in every 3 months for her cleaning until everything is fully set. And even at that point, once you have implants, we need to keep them clean. So she'll still continually come because of those implants to keep everything clean. So this patient in the middle, this patient came in because she noticed that her tooth on her right side, so if you're looking at the photo, it's on the left side, that tooth that looks very gray. She was noticing that it was turning gray. It looked like a big cavity to her. She was very concerned, as well as her front tooth on her left side, which in the picture, it's the center tooth on the right, looked more discolored. So she decided that she wanted to fix that darkened tooth, but because of the way her teeth were rotated, she really wanted to also correct some of the aesthetics of her teeth at the same time. So we ultimately ended up doing 6 crowns, a mix of crowns and veneers on her teeth to correct that alignment, and also to fix the cavities that were going on in a few of those teeth. But the reason that we did crowns and veneers were to mainly fix the aesthetics for her. She could have just fixed that one tooth that had the really bad cavity, but she wanted to correct her overall smile. And then we're also going to be doing some other treatment to correct the alignment of the lowers, her bite, some other things as well. But she was very happy with that. And I apologize, the gums are very inflamed, and this picture was taken right after we cemented it. So everything was not totally healed up yet. But as you can see, she definitely has an improvement so far. And then our patient on the right is a little bit different. It is facial aesthetics. So we did a mix of Botox and fillers on her so far. I did this case probably about 1.5 years ago now. So there's some things that, looking back at it now, I would do a little bit differently. But on this patient, you can see that she has a lot of droopiness in her, what we call our marionette lines. And she just didn't like the appearance of it. She felt like she looked tired and sad all the time. So we added some fillers to the area to correct it. Again, her face is still red because this was immediately after. So we corrected some of those areas. She liked the way that everything looked and made her look more youthful, filled in those areas. But you can use fillers for a very wide range of things. So for her, looking back, we would probably go back through and do some cheek fillers as well to give her that lift, because what happens over time is that as we age, gravity starts pulling down. We lose the fullness. We lose the fat content in our faces, the collagen, the elasticity that holds everything up nice and high, which is why we get those lines or those wrinkles from that sagging as we age over time, when we lose that elasticity to our skin. So fillers really can be a initial step, and it's less invasive to add that more full, rejuvenated, hydrated look, as well as Botox can be used to, again, help smooth the skin, to prevent future wrinkles, to help soften existing wrinkles. So it's cool. You can do a lot with that. As a dentist, it does require an extra certification process, but it is something that we can do as dentists, and we are very highly skilled in being able to offer that because we are experts in head and neck anatomy. We have we are some of the most highly trained professionals in that area. So, and we do injections all day long. So it's something that is very easy for us to do. And I truly think that if it's something that dentists are interested in, they should really take advantage of being able to offer that to their patients. So those are just some fun cases for you guys to see. And then last but not least, just wanted to give you guys some advice in the application process. You know, as you're going through college, dental school, I know most people are probably on summer break at this point, but just things to remind yourself of consistently that your journey is unique to you. So if you're someone that you may have to take a year off. You may be a non-traditional student applying to dental school, or maybe you just feel like in your path things have not aligned in the way that you would like them to. You know, everyone is on their own journey. Do not compare yourself to your classmates, to your friend in college and dental school at any point in life, because we can all get to the same destination, but our way that we got there may look different, and that's okay. The experience that you get along the way is going to make you that much better of a dentist if you ultimately choose to go that path, or whatever it is that you choose to do. It's going to make you that much better when you embrace your journey that you're on, the experiences that you have along the way, and don't compare yourself to others in the process, because the comparison is the thief of your joy. It will not help you. It will only bring you down in the process. So just keep that in mind and show yourself some grace in the process that, you know, we have good and bad days, but you are your only competition. You are the only one that you should compare yourself to. And then we cannot have success without failures, guys. That is so, so true. I'm sure it's not the first time you've heard that, but it's so true. Just to give you an example for myself, when I was in college, I think I had a C in my Bio 2 class and a C in one of my other classes. And I remember people telling me, if you ever get a C, you're never going to get into dental school. Things are never going to work out. You know, it's the ultimate death of things. But it's, you know, there's not everything is going to be perfect, whether it be failing a exam, whether it be getting a bad grade in a class. You know, take whatever quote unquote failures that someone tells you that they are and turn them into learning experiences, turn them into stepping stones, and use them. Those weaknesses can all become strengths if you use them properly. So again, just kind of changing that mindset for yourself that, you know, don't let yourself get stuck in that feeling of failure, because you can't be successful without having failed. Those are what teach you. Those are what allow you to grow and develop. So just keep that in mind. Any questions?
All right. Thank you so much, Dr. Sweeney, for that amazing presentation. We're going to go into the questions really quick. Before we start, I want to say I love that quote about comparison is the thief of joy. That's one of my favorite quotes, and I think it's important for all of us to remember not to really compare ourselves to each other, because all of our journeys are so different. So
yes, absolutely.
Yeah.
Absolutely. It's a tough lesson to learn, and it's a lot easier said than done, but for real, guys, especially when you're in dental school or a program where you guys are all in the same environment, taking all the same classes, doing all the same work all the time, it's very easy to look at someone else's and compare your work to them. But things are going to come easier to some people than others. So something may require more work from you. Something might require less, and just focus on yourself and be better than you were yesterday.
Exactly. That was super motivational. For the for the first question, did you work during dental school, and is it possible?
Yeah, so it's not easy, for sure. It's not easy. You have to be very smart with your time, and again, show yourself some grace that when you're in dental school, that is your number one priority. But I understand, you know, we need to make money. I did work in dental school. I didn't work my entire 4 years, so I believe I started working the end of my second year of dental school. So I was actually a fitness instructor. I worked at a bar studio that was not far from where I lived or my dental school. So what I would do is I taught very early morning classes, once or twice a week, would go straight from there, straight to my classes. So I would teach like a 5-6 a.m. workout class, go straight to school. And then I also taught some night classes during the week after, as well as some weekend classes. So again, I really had to wait, or I chose to wait until I was more in the groove of dental school. I wouldn't necessarily recommend working your first year of dental school, unless you're someone who like, you know, that you are great with your schedule, you know, you can make it work, then more power to you for sure. But it's a big adjustment. Adjusting from college to dental school is a huge adjustment just because you're not used to being in such a high volume of classes. I wouldn't say that your classes are any harder in dental school per se. They're different, but you're in such a high volume. I know for us, our first year, we went from, you know, in college, you were in 15, maybe 17 credits a semester with a more packed semester. And then in dental school, we were in about 30 credits a semester. So just to put that in perspective, you're in a lot of classes, a lot of time. It's not just being in school, but it's coming home and studying for, you know, pretty much the rest of the night, almost every single night. I don't say that to scare you. It's just to put it in perspective that you definitely can work, but you need to figure out what works for you. Do not, you know, overwhelm yourself with that. So if you do, it very much has to be something that maybe you could do on a weekend day or night, but still allow yourself to dedicate most time to dental school. Again, as you get later in dental school, so by the time you get to your second, third, fourth year and are more transition to clinic, you'll really get a better grasp on the time that you have, the free time that you have. So I did work, but I waited till I was closer to being in clinic and knew I had some more free time that I could utilize for that.
Okay. For the next question, what are some of the most valuable things you learned from your mission trips, and how do you become a part of one in undergrad?
So I actually did my mission trip in dental school, but I'm sure there are colleges or other organizations that do offer mission trips. You just might not be able to do hands-on work in a medical capacity just because they often want you to either have a license or be in the process of that. But there are plenty of ways to get involved in that, anywhere from church organizations to community organizations that offer that on a regular basis. Again, I know things the past, you know, year, almost 2 years have been a little bit different, but many churches, many organizations have mission trips locally and internationally all the time. So it's just really researching what's available in your area. In terms of what I think the best thing that I got out of it was really just the service that you can offer to these individuals who all they want is to be able to take care of their health, to be able to take care of their family. I think I probably got more out of it than the people that we were serving, because you're just being able to provide this care for them and this service and skill set that they really didn't have access to. So some of them would walk 5 hours or drive 5 hours just to get to you because you were the closest clinic that they had in these environments. So being able to be a part of that and help establish that care in a place was so important to me. That's what has kept me involved in nonprofits, even to this point, that I'm hoping to extend the reach of the nonprofit that I work with, you know, statewide and nationwide, because being able to step into that space that is so necessary and increase the access to care to individuals who don't have it is, to me, has been something that's been on my heart for years and years. So I love being able to do that, and it's something I'm really, really passionate about. But there's just, I could talk all day about what I've gotten out of that.
For the next question, I know you talked earlier about scholarships and military scholarships. Could you elaborate more on those type of scholarships and maybe how to seek them out?
So if you, honestly, I would start with a Google search of, you know, military dental school scholarships. I am drawing a blank on what the true name of it is, so I apologize. I can't really speak much into them because, again, I was not an applicant on it, but I know a handful of people who did it. If you reach out to me personally, I may be able to give you some people's information who I know did those programs or are currently in them. But yeah, there's different Army, Navy, Air Force scholarships. So literally typing that into Google will be able to give you a route to them. But I know you can apply prior to dental school as well as in dental school for both those programs, as well as the federally qualified health centers. Again, I apologize, I can't think of the actual term for it. Mm-hmm. But both of those, I know you can apply prior while in dental school as well. But I know if you wait until you're in dental school, it is more difficult and there's not as much scholarship available. So ideally applying beforehand, because there's a lot of applicants for it,
Mhm.
but they do have a, I believe there's like a test and different interviews and application process to each of them. But again, for each year that they offer you scholarship, if you get it, you owe them 1 year of service. So it's a great option, but just something to keep in mind that you would have to be with them for, 2, 3, 4 years, whatever it is that they gave you the scholarship for, you are responsible to serve those years with them as well. But it gives you great experience, pays for your dental school. It's a great option. So definitely look into that if you think you might be interested.
Okay. I loved the third case that you did with
Mm-hmm.
the fillers.
Mm-hmm.
Could you kind of explain the route to certification and for the aesthetic procedures like injections and fillers? Because I never get to
Yeah,
really see
yeah.
that. Yeah.
Yeah, absolutely. So it's not something that every dentist does, but it is something that every dentist has the ability to do.
Okay.
So the certification process for that, there's a bunch of different courses available. There's two main ones that I really like and have not a lot of notoriety and recognition. One of them is the American Academy of Facial Aesthetics. The other one is the International Academy for Facial Aesthetics, I believe. But both of them, it's typically, I want to say, like a weekend to a week process for their initial certification. Basically, they go through anatomy, physiology, the types, brands, how to actually do the injection process, as well as live patient injections, teaching you all of that. That is the only thing that is required to start your practice in Botox and fillers, is you just have to have the initial certification to give to your malpractice insurer to make sure that you are covered and responsible for that. Past that, they have more advanced training courses, things like that you can take. It's not required to do that, but it does obviously give you more experience, better understanding into different procedures. So when you're getting into like lip fillers versus cheek fillers and all the different stuff, there's also what they call PDO threads that can help lift, they can smooth. So there's a lot of different things available that dentists can do, and it just requires you to go to a program, do hands-on training for typically like a weekend, maybe max a week.
Okay. Cool. I love that, and that's super interesting
Mm-hmm.
because, like you said, I'm sure a lot of us don't really see that in a normal dentist office.
Yeah, and a lot of patients, it's becoming more normalized, but a lot of patients don't always realize that dentists can do that.
Mm-hmm.
And being able to offer that service as a medical professional, as a patient, I would much rather have a doctor, a dentist, even a nurse practitioner administer my Botox and fillers versus someone who's an esthetician at a salon. Not knocking estheticians in any way, but they just don't have the medical and anatomy training that we do. So just keeping that in mind that, patients are always going to get that stuff done elsewhere. So if that's something that interests you, why not offer it to your patients who are already looking to get cosmetic procedures done? If they want a smile enhancement, they want something else, you can help them achieve the smile and the facial aesthetics that they're truly desiring in one place.
Right.
So
I love that idea too, like you just said about one place, like a one-stop shop.
mm-hmm.
And this next question kind of relates to that. I know you said you're in private practice. How does an office function with having multiple specialists work in the office versus strictly general dentists? And does it help an office run more efficiently? Is it more convenient than referring out to other doctors?
Mm-hmm. So it definitely is. It's requires enough office space. It requires a lot of planning because the specialist, you have to have a full enough schedule for them to want to come in, to be there. But I love being able to have that access to my specialist. I've worked in places where we did refer out, and there's nothing wrong with that. Sometimes the space doesn't permit it, your schedule, different things like that. But it's, for me, now having our specialist there, I have a much better relationship with my specialist, I should say, sorry. Being able to reach out to them, show them cases, show them an x-ray, ask them their opinion. And then the patients love it because they don't have to go anywhere else. They come to the same office, just on a different day and time. And then oftentimes we can schedule multiple treatments together with the specialist and I both there together. So it really allows us to do, I believe, a better job of comprehensive care for all of our patients because we have everything right there. They like that they don't have to go elsewhere, and allows the practice to produce more, to see more patients. We even get outside referrals when our specialists are there. We'll get referrals from other private offices that refer a patient to our office because of our oral surgeon or because of our endodontist, things like that. So yeah, it's a big practice builder, but again, you have to have the space for it. You have to have those connections and network with specialists to have them at your office and be able to support them in that way.
That's super cool. The next question, I know you said that you did some research,
Mm-hmm.
and the next question is, how heavily does research weigh in the application process? Do you think that it's really needed? And I know you talked about finding something that you enjoy because you're able to talk about it more
Mm-hmm.
in your interview. If you are not able to find something that you truly enjoy, is it worth it to do research at all? What do you think about that?
So this comes back to researching your schools
Mm-hmm.
because I know when I was applying, all the schools that I was applying to, research was a must. It was a non-negotiable. You had to do research. It didn't matter, how much research you had done, but you had to have done research. So I can't speak for every school, but I do know the ones that, I applied to in Pittsburgh specifically, like you have to have it on your application. If you don't, don't quote me on this, but I'm pretty sure that some schools, if it's a requirement, for example, say, even research. So research, or let's say a specific class, if it's not on your application and that school has it as a requirement, you will get tossed aside. They won't even look at anything else on your resume. So again, I'm not saying every school is like that, but do your research and know what schools require and know what they recommend. Recommendations are exactly that. They're recommendations. It will help improve your application potentially, but if something's a requirement, it's a requirement. So that's where that ADA book comes in handy, is it specifically says what are requirements in terms of classes. So some schools may require an extra anatomy or physiology or something else. They may have it as a requirement where another school may not require it at all, or they may recommend it. So just keep that in mind. But yeah, obviously trying to find something you like. If a school doesn't require it, you don't need it, and you have no interest in it, then don't force yourself to do it. But if they do require it, keep that in mind, that if you don't, I can't speak for what might happen with your application.
With those requirements that you're talking about, as far as prereqs, and even earlier when you were talking about averages and scores and GPA,
Mm-hmm.
when do you decipher when to toss a school out if it is a reach? How do you gauge that?
I think for me, so I didn't apply to many schools, which was very risky. Whereas I had other friends who they applied to a ton. So I think it comes down to how many schools are you going to apply to? Always trying to, of schools that you decide you like, whether it be based on location, determining which ones are a good fit for you, and then determining how many you're going to apply to. If you don't have a limit, then if a school you love it, but you think it's a big reach school, go ahead and apply for it if you can do that. But again, I know for everyone that's not an option due to finances, or just because you're not going to go to all the way across the country for school. So keeping that in mind, it's again kind of a personal choice, that if you have the ability to apply to all of them, obviously you're increasing your odds potentially of getting in. But if you're only applying to a handful and that one's maybe a more iffy school for you anyway, don't waste those few applications on something that you don't think you'll get into.
Thank you.
Mm-hmm.
For the next question, what are some tips that you might have in a personal statement, maybe pros and cons of what to write about?
I'm not trying to think back to my personal statement. How aging me. Making it unique for sure, being able to talk about something personable to you, well, unique to you, that's a poor word choice, but something unique to you that, someone will read and remember, versus just generic things of, I want to help people. Everyone going into dental and medical school, quote unquote, wants to help people. So that is not going to set you apart. But yeah, talking about anything unique to you, Maybe for you, it's how you got interested in dentistry. Maybe it's a unique story from your family, whatever that is. I'm trying to think back to mine. I want to say that I related mine to track and running and sports because I was an athlete growing up the entire time. I was like a nationally ranked track runner. So I think I had related that to dentistry and my path on that, different things. So yeah, I try to keep it unique to a story for myself. And again, finding people who can tweak those personal statements for you, whether that's a college advisor, a dental school advisor, anything like that, or even a current dental student who's offering that services. Again, I know there's a handful of people on social media who are big into that realm. So just finding someone who maybe can take a look at that for you and offer you that advice. But again, just be thinking what sets you apart, what makes you unique that you can put into that essay.
Okay. Another question with the personal statement. Do you think it's better to touch on multiple subjects that might make you a strong applicant, or to hone in on one specific trait or attribute? Or
That's a good
theme?
question. I think it can go either way.
Okay.
You definitely don't want to make it sound like you are just explaining your resume in another written form.
Mm-hmm.
So if you do talk about multiple things, as long as you can do it cohesively and it blends together into basically a story, I think that can be okay. But try and limit yourself to, a few things. Don't be listing off your entire resume of everything you're doing, because they have your resume. They can see that. They would rather see more of you, what makes you unique, and something that they're going to remember in that statement versus just everything that you've accomplished.
Okay. And I think we have time for maybe one or two more questions. Let's go with what are some of your favorite procedures in the office?
Oh, depends on the day for me, because I really enjoy oral surgery and I really enjoy cosmetic procedures, doing like crowns, bridges, veneers, even facial aesthetics I love. So it just really depends on the day. I would say overall, I tend to go more towards cosmetic procedures if I had to choose anything, but I really do love oral surgery as well. So it just depends on how I'm feeling that day. And that's what place in dentistry. I will go from oftentimes having a surgery and extraction to jumping right into veneers to Botox to doing a root canal. So it really can be across the board, and that's what keeps your day so varied and really keeps you on your toes.
Mm-hmm. And then another question, this is actually the last question. What are some of the most challenging things about dentistry, whether it is currently in your job or throughout your journey to becoming a dentist?
Yeah, so the most difficult thing I would say with dentistry as a practicing dentist, and even as a dental student, is anytime you're dealing with patients, it can be difficult because you're dealing with different personalities. And as we all know, the dentist is probably the main doctor to hate. People will often come into you. It might be the first time you're ever seeing them, and they always feel the need to tell you, hey, you know what? I hate the dentist. I don't like being here. And, we always make jokes and kind of laugh it off and try and make a patient as comfortable as possible. But the reality is you are often getting people who they don't necessarily want to be there. They're already scared. They're already upset or nervous, whatever it is. So dealing with patients who are angry, whether it's, something that you did or did not do, just learning to deal with that. You're going to get that in any medical realm, dealing with patients or dealing with people. I think that can oftentimes be the hardest because dental school doesn't necessarily prepare you for that. They may give you a few scenarios, but it's really learned through experience, through interpersonal skills, empathy, things like that, of learning how to deal with patients, how to meet them where they are. Maybe you just need to be the listening ear for them, discuss different things with them. But yeah, I would say that was the biggest learning curve for me, especially when I came out, is, I knew how to do every procedure, but I didn't have the experience of dealing with that. So that's something I've come a very long way in the 2 years that I've practiced of, how to really handle patients, make them comfortable, deal with different situations in kind of whatever situation is thrown at you.
Wow. Thank you so much, Dr. Sweeney, for that amazing presentation. We really enjoyed it. If anyone needs to contact Dr. Sweeney, her socials are here below. Again, we thank you so, so much for that presentation. And if you have anything else to say, feel free.
Yeah, absolutely. Thank you guys so much for having me. If, just as Gabrielle said, if you guys have any questions, feel free to reach out to me. It may take me a few days to get your message, but I promise I will respond to you. So feel free to reach out to me on whatever avenue works for you. I'm always willing to answer questions, explain something further. But yeah, just thanks so much for having me, and I hope you guys have a great rest of your week, and good luck in school for anyone who's applying. This upcoming application process, might be studying for the DAT, anything like that. Good luck. You guys all have what it takes to do it. Going back to it, you may have, your journey may look a little bit different, but if it's really your passion, you will get there. Don't give up on yourself in the process of it, and just really keep pushing until you get there.